Inkblot is based on the belief that mental health services should be convenient, affordable, and confidential. We have Arash with us, who's the co-founder of Inkblot Therapy. Thanks a lot for joining in, Arash.
Thank you so much for the invitation. It's great to be here.
So I was reading this while doing my research. I was reading this old article in Global News. I think that was dated back in 2017 that stated that 500,000 people miss work each week due to mental illness in Canada. I mean, like that's a worrisome stat, and that's like that was dated 3 years back. So what are you building at Inkblot to solve this problem? And why did you start it in the first place?
That's a great question. And even outside the workplace, there's the mental health burden is tremendous. It's the number one cause of disability worldwide. 1 in 5 people have clinical mental health difficulties every year. So the human suffering and the economic burden is the largest of any factor.
Right.
As a physician, I found that my patients who were having mental health or addiction difficulties, no matter what amount of, no matter what kind of work they had or what benefits they had at work, and as well in the public sphere and in public healthcare system. So for the most part, really had poor access to high quality, long-term mental health support. Mm-hmm. And it's one of those areas where those things actually matter quite a lot. So to be able to really connect with someone and build a therapeutic relationship and have this long-term journey with someone who can support you is crucial. The second part was the high quality and accessibility part. So there's a few things that make mental health services currently inaccessible. So oftentimes people just don't have services where they live or the specialized services they need or culturally appropriate services in the languages which they speak. So oftentimes the care is just not there. And even when it's there, there are a lot of barriers. It's expensive. It's $150 to $200 an hour. It is office hours. So there's a lot of barriers. And which is tragic. So I started off with trying to solve all those issues, and we feel that we've made great inroads in that way. So our solution is half the national price. Our solution is 3 times more effective than traditional face-to-face mental health care, and it's seamless. It's available from anywhere, coast to coast across North America. So we've worked really hard to really address those factors. When it comes to employees in the workspace, which is also a big focus for us, we also consider the workplace itself almost as a person. So we also look at the workplace, the psychological health of the workplace. We make, predicting and providing insights to organizations about workplace culture, about their employees and how they're doing, and so on, which can be quite powerful. So, we found that in order to help people feel better, we also need to improve the workplace oftentimes as one of those things that can make things difficult for them. So we work alongside employers, as well we work alongside individuals to really help improve the psychological health of the population.
Okay. So as you mentioned, Inkblot is focused more on virtual care. So although it's more convenient and accessible, on the other hand, I guess it's difficult to form that relationship with your care provider when you're doing it in a virtual manner. So how do you balance these aspects, and what has been the feedback from your users for this one?
Yeah, that's a great question. And as a clinician myself, I always kind of felt that I wouldn't be able to form the same kind of relationship virtually as in person. But I have been proven wrong, and there's a lot of evidence to show that it actually doesn't work that way. The main reason being a couple of factors. The first is that when people are telling their life story and you're in the conversation, the
Right.
screen kind of disappears. You're in the flow of that conversation,
Mm-hmm.
and that aspect becomes a lot less crucial than people initially think. There's a
Okay.
couple other factors that go into it. One is that people are a lot more comfortable in their own homes.
Right.
So what happens is when someone comes to clinic, they're
Mm-hmm.
coming to an office. They're in this location that's not their home turf, and
Right.
so oftentimes it feels clinical. People close off, and the
Mm-hmm.
kind of conversations you have with people, especially in mental health, when they can be in a location that brings them comfort in their own home, in their own room, those
Right.
conversations are very different.
Mm-hmm.
Because that person, they're not coming to the office to see someone,
Right.
and parking and sitting in the waiting room and so on.
Yeah.
It's the comfort of home. So the
Mm-hmm.
conversations tend to be a lot richer. The
Mm-hmm.
last thing I'll say is that people miss less sessions.
Oh,
So
okay.
it's one of those things where finding parking, finding daycare for your child, finding
Mm-hmm.
getting time off work. Those are big barriers, and people oftentimes will book a session on the same day, and they'll miss those sessions because
Mm-hmm.
they just had a hard time getting there, or they had a hard time feeling motivated. Someone who's
Mm-hmm.
depressed doesn't have that intrinsic motivation,
Right. Yeah.
and so getting out, getting dressed, getting in the car,
Mm-hmm.
getting there, all those steps are
Yeah.
big barriers. So the number of sessions which are missed is significantly lower. Um,
Okay.
so
Okay.
there are those factors, and of course, video allows the cost to be lower. So someone
Right.
gets twice the number of sessions.
Yeah.
Um, so there are a lot of factors which actually
Mm-hmm.
make it, and we have data to show 2 or 3 times more
Right.
effective than someone in
Yeah.
person.
Okay. Okay. That's
I
good to
should
know.
I should
Yeah.
mention that in
Yeah.
our business offerings, we do offer in person and voice as
Mm-hmm.
well.
Right.
Large companies, they often want the option of having their
Mm-hmm.
employees access care, even if they don't have internet, and we provide
Right.
those options.
Yeah.
Our direct to consumer is by video only, just for those
Right.
various reasons.
Okay. Okay. Understood. Yeah. It's always good to have that option. Yeah. Okay. So I believe like when it comes to mental health, awareness plays a big role. Like realizing that you need access to mental health care and it is available out there. Like that's a big step I think in itself. So is Inkblot contributing to this aspect as well?
Yeah, we do it in a couple different ways. So
Mm-hmm.
there's the usual kind of social media and so on. So there's kind of the usual awareness aspect. The other
Okay.
thing that we do uniquely is that when we onboard a company,
Mm-hmm.
we get all their employees to do a mental health assessment. It's about
Okay.
3 minutes long.
Right.
And then what each employee gets is their profile benchmarked. So
Okay.
you may feel like everybody else is also stressed and anxious and worried and so on. And especially in currently within a post-COVID world, or currently in the COVID world, um, it's hard to know what is normal.
Yeah.
Where am I in that spectrum of people who tend to worry about things? And
Right.
so we're able to provide people that benchmark data so they can see, compared to 1,000 other employees in that sector,
Mm-hmm.
in the last couple of months, how they're doing, how they're doing on an individual basis.
Okay.
And we found that's been really powerful, where people suddenly realize that, what I'm experiencing is not normal, and perhaps this is more than I thought. Um,
Okay.
to kind of help calibrate that internal sensor of
Right.
where they're at.
Right.
And because it's such a fine line, and humans are super flexible, we
Mm-hmm.
we bend ourselves to our environment as much as possible until
Mm-hmm.
things just kind of don't give anymore.
Mm-hmm.
And this really helps people understand where they're at. So there are a few other things we do, but
Mm-hmm.
there's the usual social awareness campaigns and strategies. And then we also, especially with companies and in the B2B space, we really
Mm-hmm.
work with employees to understand where they are and how they're doing.
Okay. Okay. So that was a very interesting point about data point. Does that become like overwhelming and counterproductive as well sometimes for employees? Like they get too entangled into this whole data and that. that enhances the problem instead of solving it?
Yeah, so do you mean in terms of the employees getting a lot of emails and messages
Yeah.
and stuff? Is that what you mean?
Or maybe just they weren't comparing themselves before, and they were doing good, and then they got into this comparison mode, and that sort of
Yeah,
escalated the whole situation. Yeah.
that's totally fair. So we have done a lot of user testing in terms of how we give that data back.
Okay. Okay.
So it's not kind of it's very soft language. There's no numbers
Okay.
attached.
Mhm.
It's a the suggestions aren't kind of you need to seek treatment.
Right.
If someone oftentimes just does more self-care, sleeps more, exercises more, they'll feel better.
Mhm.
So the goal is not to kind of make people say, oh my God, there's something wrong with me.
Yeah.
The goal is to bring awareness to where we're at, and we've done a lot of work in terms of that user experience of when they see the report, making
Mhm.
sure it's not clinical sounding, make sure it's not diagnostic, just getting them a feel for where they're at and a few lifestyle recommendations.
Okay. 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 And so also, like, since most of your services are provided virtually, are you guys planning to make it more accessible to people outside North America as well?
Yes, so there are, and we looked at that. The issue is liability
Okay.
and legal more than
Yeah. Yeah.
practical. So,
Mhm.
and we do have companies that have employees throughout the world, um,
Okay.
and we do provide services to all of them in various countries.
Right.
Um, so although our focus is primarily in Canada and the U.S.
Mhm.
We do serve employees in many countries and individuals in many countries.
Mhm.
Um, but as with any enterprise to kind of expand to new markets in a
Mhm.
very wholehearted way and heavily market, you
Right.
really want to have really deep understanding of those markets. So
Okay.
we do serve people, but it's just kind of doing it really well in each country
Mhm.
is a bit trickier.
Mhm.
Um, so and of course there are countries where the stigma is really high, and and in those countries, oftentimes these kind of solutions really help those individuals who are having a hard time because it's
Mhm.
a lot more confidential. People can do it, in their lunch break, in a corner somewhere, and they don't have to kind of, it's a lot more private.
Right.
Um, and so we strongly want to kind of help in those scenarios where that stigma is
Mhm.
really high.
Mhm.
Um, and individuals who are having a hard time knowing how to manage life and difficulty coping. So,
Mhm.
um, but again, as with any enterprise, we're limited in terms of our resources and timelines.
For sure. Yeah. And if I understand your business model correctly, like, you have sort of a B2B aspect where you're helping employees through their employers, and then you have direct to consumer, if we can call that. So are you equally focused on both of these, or is there more focus on one over the other?
Yeah, so direct to consumer was we started with direct to consumer, and we spend a lot of time thinking about direct to consumer and their experience,
Mm-hmm.
primarily because it's highly aligned with the values of the company, trying to bring care to those who otherwise would not have access.
Right.
So we do spend a lot of time focused on that, but at the same time we don't do any heavy marketing
Okay.
on that, simply because in direct to consumer, you need a lot of resources for headspace and doing kind of sufficient marketing. So
Right.
most of our, in the B2B space, is where most of our sales and marketing is focused.
Right.
But as an organization, we care a lot about that individual experience,
Mm.
whether it's an employee or whether it's direct to consumer.
Okay.
We also work with a lot of partners, um, whether it's insurance brokers, whether it's telemedicine companies. So we work with
Right.
a whole range of channel partners, and again, in those scenarios, managing kind of making sure that we're solving very strong pain points. The last
Mm-hmm.
thing I'll mention is that in Canada, for example, the pain points and what the barriers are is
Mm-hmm.
different than in the US.
Okay.
And so, a lot of our work is really understanding and adapting our solution to those different markets and the pain points that the public experience.
Okay. Okay. Got it. And if you speak again in 6 to 8 months, where would you want Inkblot to be in that time frame?
Yeah, so I think one of the things that kind of underlines our vision is that we as a company are not going to we're not going to treat all the world's mental health problems. So part of our vision is to really empower organizations who are in this field with our tools and technology that we've built,
Right.
so that they could be part of, and we could empower them to do, whether it's operations or managing the work, to do that even more effectively across various channels.
Mm-hmm.
And so we're already kind of we already have a whole focus in that way, and we're going to expand that more over the next several months in
Okay.
terms of empowering NGOs, clinic networks, agencies, individual practitioners,
Mm-hmm.
to really provide them with all the tools that we've developed, so that they could provide more effective data-driven care
Mm-hmm.
to the people they serve.
Okay.
So that is a focus for us, and it's something that we're excited about, and it's a slightly different focus.
Mm-hmm.
The other bit is the other kind of big focus for us over the next several months is to provide even more robust care surrounding the determinants of mental health difficulties.
Okay.
So financial advice, career advice, legal advice.
Right.
And this is a time where especially people with unemployment rates going high, people having their wages cut, we strongly believe that career counseling and financial counseling need to be part of mental health care, and they
Right.
need to be integrated into a team approach,
Yeah.
where we're able to help people with those stressors. We're able to alleviate and bring really robust collaborative care on that front.
Right.
So that is a big focus for us, and something that we're expanding in the work that we're doing.
Okay.
And the last bit I'll mention is that medications is often a big issue,
Mm-hmm.
and there's in the psychiatric world, when it comes to medications, there's a lot of uncertainty. There isn't really very robust data-driven care similar to some other areas in medicine, and we're super excited about some of the work we're doing on that front, and really bringing a very different lens on how medications are used
Okay.
by those who are having a hard time.
Okay. Okay. Awesome. And lastly, Arash, so at Epic, we are also trying to connect you with, people out there who would be able to help you with various aspects of your business. So are there any areas where Inkblot is looking for some help?
So we're always open to partnerships and collaborations,
Mm-hmm.
whether it's with the public sector, whether it's with the private sector,
Mm-hmm.
with organizations, whether small or large.
Right.
So we're a very open company in terms of partnerships, and we really believe in collaboration as a pillar of mental health. So as they say,
Right.
relationships heal,
Yeah.
as well as kind of just in general in terms of how we tend to operate. So
Mm-hmm.
for us, partnerships and insights into B2B and new markets,
Right.
in organizations which are really looking to do great work, and
Mm-hmm.
where we can empower them with through our platform. So all of those factors are
Okay.
things where we're always looking to connect and partner.
Okay. Fair enough. Fair enough. Good to know. Well, Arash, this was really awesome. Really good to know how exactly are you building Inkblot and helping solve the mental health issues for employees on one hand, and for your direct consumers as well. Thanks a lot again for your time.
Thank you so much. I much appreciate it. Best of luck with the endeavor.